Welcome back to Insight. I'm here with Aging and In-Home Services of Northeast Indiana. We're talking about being your own healthcare advocate. We were talking about how you need to write everything down. So now I need to know, when do I speak up? When do I talk? All the time?
No, at every healthcare encounter.
So everything you wrote down, whether it's in this book, whether it's on a piece of paper, wherever, on your phone, it depends what you prefer. Bring it all with you, and you speak up as soon as you get to that appointment. When you're in the room, when that nurse or medical assistant's asking you all those questions, that's when you share, your medication list. Have them compare it, update it, etc. Share some other concerns, and certainly when your provider comes in, share these questions that you have with them as well. Communication is key. And for you to understand your situation, for the doctor to understand what you've been feeling, you have to be able to communicate that. And studies have shown that asking questions about your diagnoses, your treatment, your medications can improve the quality, the safety, and the effectiveness of your healthcare and your healthcare team. So that is definitely critical. And the National Patient Safety Foundation has created 3 questions that they feel all patients should be able to answer when they leave their appointment. And so they have to be asked first, of course.
Yes.
So number 1 is, what is my main problem? Being able to understand what the number 1 issue they're having is. Number 2, understanding what they can do about it. And number 3, understanding why it's important. I think that last piece, so many people overlook or they don't spend so much time, but understanding why it's important for you to do whatever's in step 2 will help you follow through.
And training your family to be aware that this is what you need to know. So if they accompany you or have to speak on your behalf, that they will do that. A lot of our healthcare interactions happen in the hospital where this is the worst time for you to be in control of these questions. You have too many other things.
It's a stressful situation.
It's a stressful situation. One of the services that we offer is an integrated care service, or care transitions is what our term is for it. And it just means you're going from one healthcare setting to another and you're transitioning. So sometimes we find people who are taking the medication they took before they went to the hospital, the medication they took in the hospital, and then the medication that the doctor sent home with them. You need care transitions, you need integrated care so that you understand what part of this you need to do now to improve your condition. And if you're not going to be able to ask, what's my number 1 problem and what do I need to do about it, then somebody else has to ask that for you.
And a lot of times you need somebody else to ask that for you. Like you said, I mean, that's a lot of information if you're not in a stressful situation. And like you said, if you're in a hospital, if you're transitioning to a rehab or a nursing home facility, that is a stressful situation. Even if you're just going back home, it's stressful.
And people always talk about, healthcare's at the hospital. Absolutely, healthcare at the hospital or the doctor's office, but your health is at home.
Right.
That's where you live with whatever your condition is, and that's where you recover, which, going back to our community education series, is going to have a lot to do with chronic conditions that you are living with that impact your health outcomes.
Quickly tell me, where can I get my own personal record, my personal health record?
Like one of these?
Yes.
So we have this, the adult health guide. We also have one that's for seniors specifically. Both have similar content. And you can just call us. We have plenty of them. Our resource center is ready to be able to mail these out, and there's very helpful tools, and they're in a plastic sleeve.
So that you can throw them in your purse and it's okay.
You
when
got
you spill
it.
water in there, I do it all the time. Give them a call today, Aging and In-Home Services of Northeast Indiana. They're a great resource and they want to be a resource for you. So let them be. We'll be right back.